Let's learn about informed consent. Today we will learn informed consent very easily. In case of medical field, it is very important. So, what is informed consent? Informed consent means before treatment, before any procedure, before any invasive procedure, before surgery, before any incentive procedure, invasive procedure, before any surgery, before any critical treatment, informed consent is needed. Okay, so or before any diagnosis screening test. So next, what is informed consent? Let's know about the definition of the informed consent. Now, medical informed consent is a legal and ethical process where the healthcare provider educate a patient about the risks, benefits, and alternative process, proposed treatment or procedure. What is the risk? What is the benefit about that? Okay, there are types of the informed consent. Okay, types of consent. One implied, one is expressed. Implied means in case of emergency situation, in case of emergency situations, implied consent is taken. Suppose a road traffic accident patient came in the emergency department. That time there is no one for or giving informed consent. That time the doctor and nurses will decide what to do and what not to do in this case of emergency situation. Even implied consent is, for example, another example is in routine checkup or OPD. Implied consent, that is also implied consent. You suppose a patient is coming in OPD. That time he is going for checkup, so that's already they are agree. It seems so. That's also implied consent example. Another expressed two type: verbal, what is informed and by verbally, and what is informed by written. Okay, verbally, suppose a patient is in front of you and you are talking what is the benefit and what is the risk, what is the good or what is the bad for it. And in written, you write a note, and what is the risk factor, what is the diagnosis, what is not to do, what is to do, that is a written. So for an example, you just focus on the example. Suppose a patient has a appendicitis and he needs appendectomy. That time, and there is needed for written informed consent. The consent will be taken by the surgeon, of course, surgeons or physicians, especially surgeon if surgery is needed. Yeah, okay. And the nurse will be present at the time of informed consent taken, and he will be the legally one persons, and you will check the informed consents before entering the patient in the OT, and before that he will check. Okay, however, in case suppose a patient, there is no one for patient to for present at this moment to give informed consent. In that time you can